In this episode, we talk about Chief Minister Mamata Banerjee visiting Murshidabad and meeting the victims of the violence. We also talk about Pakistan's retaliation after Operation Sindoor. But first, we talk about one of India's biggest hospitals that has failed to uphold a key commitment it made to the government. Hi, I am Niharika Nanda, and you are listening to Three Things, the Indian Express news show. Indraprastha Apollo is one of Delhi's most well-known hospitals. Located on the Delhi-Mathura road, a prime stretch of real estate, it sees hundreds of patients, not just from India, but from several other countries as well. And what's important to note is that when Apollo was allotted this land more than 36 years ago, it was agreed that as part of the lease, the hospital would pay just ₹1 per month. But in return, it had to make a big commitment. As part of its deal with the state, the hospital was required to provide free medical diagnostics and other essential care to patients from economically weaker sections of the society.
The hospital was mandated to reserve 1/3 of its 600-bed capacity, which is 200 beds, for free treatment of such patients in both the inpatient department and the outpatient department services.
That's the Indian Express's Ankita Upadhyay, and she says that reserving 1/3 of its beds for such patients was a key part of the land deal.
And according to High Court documents that I have accessed, it was not a commercial venture, and the hospital was supposed to provide super specialty facilities to the poor and the citizens, and the needy citizens, basically, the patients who cannot afford such expensive treatments at private hospitals. And the interesting part is that the Delhi government also has a 26% equity share in the hospital. So this means that if whatever profit is generated, the 26% of that will go to the Delhi government.
But she says that more than 30 years later, that promise is now under scrutiny, not just by health activists or patient groups, but by the Supreme Court of India as well. In fact, a detailed investigation of 12 years' worth of internal hospital records reviewed by the Indian Express shows that Apollo has made only limited use of the beds meant for patients from economically weaker sections. To understand the timeline of Apollo's social commitment, its shortcomings, and what the Supreme Court is now demanding in the case, my colleague Shashank speaks with Ankita in this segment.
Ankita, at the center of this entire matter is this land deal, right? Where Apollo has had to pay just ₹1 per month in exchange for a commitment that it would reserve 1/3 beds for economically weaker patients. Are such land deals and commitments common for hospitals?
Yes. So there are many such hospitals in Delhi that were given land at concessional rates, and they promised to provide treatment to poor patients. Such land for service deals are very common, especially when private hospitals are given public land at concessional rates. So what happens is governments, they enter into these arrangements to ensure that economically disadvantaged section of society, they get access to healthcare. So in exchange for this subsidized rate, the concessional rate at which land is given, these hospitals are expected to reserve a portion of their beds and consultations and services for free or subsidized treatment. However, enforcement of these agreements has often been very weak, and the monitoring has been really weak by the government, leading to disputes like the one where Apollo Hospital is currently involved in. There are many such hospitals which, they undergo inspection, but I don't know what's happening when it comes to these monitoring committees that were set up by the Delhi High Court. We are still questioning the government on what's happening on that front, whether they are monitoring or not.
Right, and Ankita, based on the records that you accessed, how much of this commitment that we are talking about, how much of that commitment has Apollo fulfilled over the years?
So we had the data, like the number of patients who were given the treatment in the IPD and the OPD section. But the data is very basic. So we have to understand how we can calculate it and how we can analyze that these total number of beds that are allotted for the EWS treatment are fully allotted. So we have to understand the bed occupancy rate. Here, it's a crucial indicator that hospitals use to track how effectively their beds are being utilized over time. At Apollo Hospital, the records that we accessed showed that the rate is calculated by dividing total occupied bed days by total operating bed days. And given the mandate that the High Court mentioned, the 200 beds, Indraprastha Apollo Hospital should have ideally have 6,000 total operating bed days per month, which should be reserved for the EWS patients, meaning 200 beds multiplied by 30 days. But over a period of 12 years, the records that we accessed, they showed that the average number of total occupied bed days for EWS patients was just 1,023, bringing the average bed occupancy rate to just 17.05%. This was very low. And Apollo has fallen significantly short of its commitment. And over a period of 12 years, the hospital maintained an average EWS bed occupancy rate of just 17.05%.
But can you also break down just the kind of services people have been able to access for free over time, especially when we look at IPD, where, patients are required to stay at the hospital versus OPD, where, they receive a diagnosis and treatment, but you're not required to stay at the hospital.
Right. So I had filed an RTI regarding this, and I had asked them what kind of procedures are being accessed by the EWS patients. So people have been coming for all kinds of treatment and medical care, but the top 5 procedures have been oncology-related surgical procedures and gastrointestinal surgeries, orthopedics and polytrauma surgeries, urology and uro-oncology surgeries, and neurosurgeries. So all the surgical procedures, especially oncology-related GI surgeries and neuro and ortho, have been the top surgical procedures that patients of EWS come for. And between financial year 2012 and 13 and financial year 2023-24, a total of 2,97,555 patients accessed free services at the hospital. 88% were treated in OPD, which included doctor consultation, minor procedures and diagnostics. 12% were admitted in IPD, meaning they were hospitalized and they had to be given a bed, surgery and long-term care, which runs from 5 to 7 days. The annual average of IPD patients receiving treatment was 2,997, which is again significantly below what should be expected if they are allotting 200 EWS beds, if these 200 EWS beds are actively used.
And Ankita, you earlier mentioned how the average EWS bed occupancy rate has been about 17% over these past 12 years. But has that rate changed a lot over time?
So to put this in context, in financial year 2014 and 15, the occupancy rate dropped as low as 12.01%. The highest, the best that they did was in 2018-19, which was 20.87%. The occupancy rate went up to 20.87%. But in the most recent years, in financial year 2023-24, the occupancy rate was again 20.5%, still far from the mandated level. And this means that on an average, only about 1,023 out of the required 6,000 bed days per month were actually utilized by EWS patients at the hospital.
And we also understand, of course, that the Supreme Court flagged this issue earlier this year. Could you talk about what the court said regarding this matter?
So on March 25 this year, the Supreme Court had issued a very stern warning to the hospital. It said that if the hospital is not able to meet its lease obligations, the court would consider directing the All India Institute of Medical Sciences to take over the management. And the court directed that a joint inspection team should be formed by the central and the Delhi government to assess whether Apollo is treating the poor patients for free or just profiting off subsidized public land. And they were supposed to submit a detailed affidavit also. The hospital was supposed to submit it, where they were supposed to tell the current bed strength, the records of OPD and IPD treatment of EWS patients over the last 5 years. And they were supposed to also give any kind of clarification on how many patients were referred by Delhi government hospitals. This warning stems from an earlier Delhi High Court order of 2009, which noted that Apollo had flouted the conditions with impunity and it failed to honor its lease term, which was for over 15 years.
And during these hearings, what has been Apollo's argument? What has been its defense?
So since the beginning, since the Delhi High Court case, Apollo has been making several arguments in its defense. It claimed that hospital was meant to be self-generating project, meaning that free treatment could only be funded from its commercial revenue streams. And it said that unlike charitable hospitals or government institutions, it is a public limited company and it is accountable to its investors and financial institutions. And it also disowned any obligation to offer free services beyond what it considers is financially a viable scheme. And it also proposed a pro rata system where the government would sponsor free treatments, positioning this as a humanitarian gesture rather than a contractual obligation. So what essentially Apollo has tried to do is to walk back from their original lease terms by trying to reinterpret them in the light of its status as a profit-driven enterprise. So this has been their argument.
And Ankita, in your piece, you also mentioned that the company has made representations to the Delhi government to actually change the current model of free treatment. Can you just talk about this proposal and how it might change things for the company if it is accepted?
Right. So Apollo has proposed a revised model to the Delhi government in which it would only be required to offer free IPD services to 10% of patients and free OPD services to 25% of the patients, of the total patients. And if accepted, this would reduce Apollo's EWS IPD bed commitment from 200 beds to about 70, which would be a drastic reduction to its original obligation. And the hospital has framed this as an effort to bring its commitment in line with what other hospitals have been providing under similar concessional land deals. But this would definitely weaken accountability and limit access to free hospitalization for the poor people. Apollo has also stated to its investors that the final impact of the issue can only be quantified after a final Supreme Court decision. So we'll have to wait and watch what happens in Supreme Court. The next date of hearing is on May 27, I guess.
And now moving on from Delhi, we talk about tensions in West Bengal. On the 5th of April, the President of India gave her assent to the Waqf Amendment Bill after it was passed by both houses of the parliament. Since then, protests have broken out in various parts of the country, including West Bengal, where one of the most violent demonstrations took place in Murshidabad last month, leaving 3 people dead and many others injured. In response, West Bengal Chief Minister Mamata Banerjee earlier this week paid a 2-day visit to Murshidabad, where she met with the victims and addressed the local residents. Her visit and public remarks offer insight into how she views the issue and what steps she intends to take. To talk about these developments, we are joined by the Indian Express's Sweety Kumari, who reports on the state for the paper. Sweety, while Mamata Banerjee met with the people of Murshidabad and visited the district, what was her narrative of the violence and the riots?
So during her 2 days visit to Murshidabad, she said that the violence was a calculated attempt to destabilize the region. And she, she emphasized that the riot was planned and it was not spontaneous. So her whole narrative, she tried to, blame outsiders for this entire episode. And during her conversation with the locals, during her public meeting, she continuously tried to say that it was a pre-planned act orchestrated by outsiders to disrupt the harmony of this region, which is a minority area mainly. So on one hand, while she strongly condemned the loss of innocent lives and said that, this kind of violence should not be repeated, but her entire narrative centered on restoring peace, ensuring justice for the victim, but also blaming outsiders and saying that it was a pre-planned and not spontaneous violence.
But who was Banerjee talking about when she used the word outsiders? Who was she referring to?
See, this is not the first time that Mamata Banerjee has been using the term outsiders. Even during 2021 elections, she had been using this term outsider since years now. So basically, whenever she's targeting BJP central leadership who are coming to Bengal during election campaign, she addresses them as outsider. Here, when we are saying that outsider, she did not particularly say that it was orchestrated by BJP, but she continuously said that it was done by outsider and investigation is on. And she clearly also said that one should not, listen to BJP and fundamentalist outfits of the region. So she has been trying to create a narrative that the people of Bengal are peace lovers. The people of Bengal does not, believe in division on the basis of religion. So because there was this violence which was communal and we all know about it. So she was trying to say that the violence was created by outsiders and BSF and other political parties might have hands in it. However, the investigation is on and let's see. But politically, she had been trying to say that it is outsiders who have done this.
And you mentioned how the Chief Minister even blamed the Border Security Force or the BSF. So what exactly was her accusation regarding them?
She criticized the role of BSF and other central agencies even in the past and said that these central agencies and BSF has been used in engineering unrest in the district and minority areas. And, she had also even in past blamed BSF for cross-border influx from Bangladesh and repeated that the growing crime in the Bengal and everything is because there's a negligence on the part of the BSF and the people have easy access from the border side. So in this particular Murshidabad case, I will quote her where she said that why did the BSF fire shots? If BSF had not fired shots, the incident would not have flared up the next day. So we know that initially the Murshidabad violence was basically, it was a Waqf-related protest that triggered into such scale of violence. So Chief Minister basically said that when the BSF was deployed, a mob had attacked border security force officials. And, we have also spoken to BSF officials in the past who said that they had used non-lethal arms to control the mob. Now, this is part of an investigation where anyone died because of BSF firing shots, but BSF had clearly denied that and said that there was an incident in Ghoshpara where there was a huge crowd which had targeted BSF, and in defense, BSF had also opened fire, and the BSF had claimed that there was no injury to anyone, but later a youth had claimed that he had received a bullet injury in the leg. This is under investigation, and unless it is verified, unless a probe has been done, we cannot comment on that. But Chief Minister has clearly tried to, shrug off the responsibility from the violence by accusing outsiders and blaming BSF.
And Sweety, the other thing that Mamata Banerjee claimed was that the Bengali migrant workers in other states are being quote-unquote tortured. Do we know whether that is true? Have there been any complaints of that sort?
Yeah, so in recent time, there have been a lot of accusations and, a lot of videos have come up. There are talks on social media that Bengali laborers are being targeted for speaking in Bengali. In fact, Chief Minister Mamata Banerjee during her Murshidabad trip clearly said that a Chief Secretary of the state has also written a letter to the state government of Rajasthan, Orissa, Uttar Pradesh and Bihar, where she has claimed that she has received a lot of complaints that Bengali speaking migrant laborers have been attacked. Murshidabad and Malda are two of the districts which is known for migrant laborers. Huge number of youth migrate from these two districts to other states. Definitely, if we go by the state government, they have received ample complaints from different migrant laborers who have said that they have been beaten up and physically assaulted, tortured for not speaking the local language and because, they are well versed with only Bengali.
Okay, so what is the solution that is being offered by the Chief Minister? What is she saying should be done?
See, Mamata Banerjee is known for being a mass leader and she's a, seasoned politician. So definitely when she was in Murshidabad, she knew that Murshidabad is known for migrant laborers. So she tried her best to, connect on an emotional front with the migrant laborers and, In her speech also, she said that around 1.5 crore migrant laborers also work in Bengal from other states. So, quote unquote, she said that we celebrate these migrant laborers, we cherish them, we love them. So why can't the other state, show similar affection towards these laborers? Now, if we talk about the solution, in her speech, she said that there is no need to beg from any other state. You can come and work in our state. We will give you some work. And, when she was addressing them, she pointed out to the chief secretary and the district magistrate of that district and said that, please DM sir and chief secretary, if you could just look into the thing and can make a list of it so that if anybody wants to come back here, you can provide them with local jobs.
And Sweety, the 3 people who were killed in the violence, did the chief minister meet their families as well?
See, CM visited Murshidabad district almost after a month, I would say, like nearly 3 weeks. Now, before CM could reach Murshidabad, we know that there was this father and son duo who was, hackled to death, Haragobindo Das and Chandan Das in Shamsherganj area. And that was the most heinous side of this entire violence in Murshidabad. And CM said that she wanted to visit the family. But before that, because victims of Murshidabad violence have been claiming that they were not feeling safe in Murshidabad, so they were taking shelter in Kolkata, Salt Lake area. It is being claimed that BJP had taken them away so that they could not meet Chief Minister Mamata Banerjee. Chief Minister Mamata Banerjee, on the other hand, in Murshidabad said that she was ready to give them compensation check of 10 lakh rupees to each of the family members. They were not available. They were in Kolkata, so she could not meet them. And what she did was she basically held a closed door meeting in presence of all senior officials, police officials, MP, MLAs. And there some of the victims, Hindu families, were invited. And she also said that she has handed over 1.2 lakh rupees to each of the 236 families who claim that their houses were burnt and, destroyed and vandalized during this violence in Murshidabad.
And Sweety, do we see this issue impacting the TMC government at all, especially with the West Bengal Assembly elections slated to take place next year?
See, 2026 election is going to be very important. If you talk about Murshidabad violence, I would say that the Murshidabad violence and the subsequent political fallout, blame games can have a significant impact on the next assembly election, which is in 2026. Now, the TMC's handling of this situation, the accusing BSF and then accusing BJP, outsiders for this, violence, and their police not acting promptly, and the situation was controlled only after the BSF was deployed. I think it took time for police to also restore peace in the area, and all this thing will be closely scrutinized by voters, Hindu voters, I would say, in that area. I think the BJP will most likely use this incident to criticize TMC's governance and law and order situation. And this incident has also the potential to polarize voters and intensify the already, heated political climate in the state.
And in the end, we give you updates about India and Pakistan. In less than 72 hours after India carried out Operation Sindoor, striking 9 terror targets in Pakistan and Pakistan-occupied Kashmir, which was in direct response to the Pahalgam terror attack that killed 26 civilians, the operation set off a chain of escalations stretching across multiple LOC sectors, civilian zones, and key security installations. 8 missiles launched from Pakistan targeted Satwari, Samba, Arispura and Arnia towns in Jammu late yesterday. The headquarters integrated defense staff stated that military stations in Jammu, Pathankot and Udhampur, which are in proximity to the international boundary, were targeted by Pakistan using missiles and drones. According to sources, all incoming missiles were successfully intercepted or neutralized by India's air defense units. The missile activity followed a complete blackout across Jammu beginning Wednesday evening, during which several residents reported seeing missile trails lighting up in the night sky. Multiple drones were also said to be spotted across border zones, triggering alerts across Punjab and Rajasthan. Indian forces reportedly neutralized several unmanned aerial vehicles, and surveillance across coastal and desert sectors have been heightened. Several Indian states yesterday moved quickly to preempt further risks. Blackouts, school closures, and cancellation of official leaves have now been enforced in Punjab, Rajasthan, Gujarat, West Bengal, and Haryana, with Himachal Pradesh and parts of Jammu raising their own security levels. This is a developing story and was recorded at 11 p.m. yesterday. You were listening to 3 Things by the Indian Express. Today's episode was edited and mixed by Suresh Pawar and produced by Ichha Sharma, Shashank, Bhargava, and me, Niharika, Nanda. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Podcast and write to us at podcasts@indianexpress.com.